Now, recently the NHS celebrated a birthday, its 73rd anniversary. Many of us took the opportunity to thank frontline staff for their care over the many decades and, more recently, during the pandemic. There were also tributes to the role that minority ethnic communities have played in the health service's history since its inception. For example, there are currently more than 42,000 Muslims working within the NHS, and more than 30% of those are in specialist positions such as doctors. On the line to us now we have Amina Shareef from Muslim Engagement and Development. Good morning, Amina.
Hello, Matthew.
Now, the history of Muslims working within the health service, in fact, is quite a long and honourable one, isn't it? How far back does it go?
Yes, indeed. It is a long and honorable one. And, Muslim people have been a part of the NHS since its very beginning. So if the NHS's birthday is 1948, we know that as early as 1963, Conservative Health Minister Enoch Powell actually launched a campaign to recruit trained doctors from abroad to fill the labor deficiencies brought about by the NHS expansion. And so right from the very beginning, Muslim contribution to the NHS has been there. And we know that responding to that call, there was an estimated 18,000 doctors from countries such as India, Pakistan, and Bangladesh. And given that these countries boast significant Muslim populations, we know that Muslim people were amongst those who filled the early ranks of the NHS staff.
And do you think that engagement between the white population of this country and people who've come from abroad in those days, certainly, and then future generations, do you think that engagement over the years has helped in race relations?
Well, we would like to believe so. And, it's always important to have contact between various groups in order to generate mutual understanding, to generate understanding of different kinds of practices, cultural practices, and faith practices. But unfortunately, at the moment, we have evidence that the Muslim presence in the NHS has generated some unfortunate experience. So there was a recent survey polling the experiences and views of more than 100 Muslim workers in the NHS. And the survey noted that 81% of those polled expressed they had experienced Islamophobia within the NHS, and 57% believed it held them back from their career progression within the NHS. And an alarming 43% admitted they had considered leaving the NHS because of Islamophobia. So unfortunately, as much as we would like to believe that this contact can generate, positive relations, it requires more than just contact to sort of make that possible.
And Amina, tell me, this Islamophobia, does it generally come from patients, people visiting hospitals, or from other staff?
It comes from a combination. So in this survey, one NHS staff, worker who wears a hijab, she actually reported she is a registrar in obstetrics and gynecology, and she reported that she had her locker vandalized and she had the word hijab scrawled across it. She also reported an incident in which she was shouted at by a member of operating staff who described her as a hazard to patient safety. And so, these kinds of accounts, demonstrate that it's not just coming from patients, but it's part of the experience of working within the NHS, unfortunately.
It must say something, though, for the progress that's been made over 60 or 70 years, that so many people of the Muslim faith now are in quite senior and specialist positions within the health service. I gave the figure out as roughly a third of 42,000, which maybe people are surprised. It's a huge number, isn't it? And a third of those are people like doctors.
That's correct. And I think that goes to show how well British Muslims are integrating in this country. They're taking education seriously. They're considering themselves a part of the British landscape. They're working towards developing British institutions like the NHS. And so, yes, it is a sign of the Muslim presence in this country and their willingness to be a part of it and take it forward into the future.
Does more need to be done, though? You talk about some of the abuse that's been aimed at Muslim people in the NHS. What can be done then to try and get rid of that sort of abuse?
Right. I think we would definitely like to see changes, such that Muslims are fairly recognized and appreciated for their efforts in frontline health services. So if we speak from the perspective of symbolic recognition and not a monetary one, we want at MEND as an organization to see an overall shift in the public discourse on Islam and Muslims. And unless and until that happens, it would be difficult to sort of represent the Muslim community in a way that enables a recognition of British Muslims as full and complete, members of the national community and therefore contributors of its public institutions. So we have, evidence from the University of Lancaster that demonstrates that there is, a predominance of negative media coverage on Islam and Muslims. So this study documented for every one positive reference to Islam and Muslims, there are 21 negative ones. So if we want to have public recognition for Muslim contribution, we need to begin not just at the level of the NHS, but also at the level of public discourse, working to change some of the imaginaries, in circulation around Islam and Muslims.
Well, we salute everyone working within the NHS and whatever their faith, and in particular this morning mentioning all the many thousands of Muslim people who work in very responsible positions like the doctors and nurses. Amina, Shareef, thank you very much for joining us this morning.
Thank you for having me.